Already under fire by those fighting President Barack Obama's healthcare reforms in America, the NHS is back in the firing line today as nurses are attacked over cruel and demeaning treatment of elderly patients. The president of the Patients Association, Claire Rayner, has called for bad nurses to be struck off the medical register. A report from the charity today revealed stories of people left lying in their own faeces and urine, having call bells taken away from them and being left without food or drink. Eileen Greenman was appalled by the treatment her husband received, her case one of the most harrowing.
I asked for the nurse to come and make him comfortable, clean him up and make him comfortable. 2 nurses came in, they grabbed each arm, telling him to sit up, John, and trying to shove a bedpan under him. His eyes were so wide and glassy. And I looked at him and I said to the nurse, "You don't shove bedpans under people who are in so much pain." They just let him go back onto the bed and threw the clothes back at him. And as they walked out, the one nurse turned to me and said, "You asked for a bedpan." I said, "I didn't. I asked for John to be cleaned up and made comfortable."
The Patients Association holds a database of hundreds of stories from patients and their relatives who claim to have been badly treated by the NHS. Today's report presents 16 of those stories in detail. Its director, Catherine Murphy, said the stories were often about the most vulnerable elderly and terminally ill patients. The government's chief nursing officer, Dame Chris Beasley, adamant that something must be done.
Very distressing. I read all the stories that the Patients Association put out yesterday, and they're extraordinarily distressing to think any one patient in our care should have that sort of treatment. I think we do have to keep it in perspective that the vast majority of our patients tell us, 93% of them tell us, that their care is excellent. But even for those, even if it's only a small number, it's not good enough, and we need to do something about it.
The appalling cases represent just a tiny minority. The majority of NHS patients satisfied with the care they receive. But as the service remains under the spotlight, concerns that public confidence in the NHS may now suffer.
Nursing is supposed to be a caring profession, and it's obviously those nurses didn't care, so they shouldn't be working in that job.